Hi, everyone. Welcome to the Belinda Norm podcast. I hope you're all doing well. For this episode, I have a lovely, beautiful guest, Dr. Masarat Jilani. Please, can we give her a round of applause? Thank you so much for joining us. Masarat, please, can you give a brief introduction about yourself and who you are?
Thanks, Belinda. That was a lovely introduction, and thanks for having me on the podcast. My name's Masarat. I'm a junior doctor, and my main passions are sexual health and self-care.
Yeah, I'm so excited to have Masarat on this. I've been wanting to talk a female doctor about female sexual health, and I know that a lot of my viewers on YouTube are girls aged 18 to 34. Or 35. And I think this is very, very important. This is about our bodies, and this is something that all women should know about. So just like Masarat said, we want to get into the topic of sexual health and female reproductive system. So I'm excited to get into it. So my first question to you, Masarat, is how do you actually get into sexual health? So like what inspired you, or who inspired you to get into it in the first place?
So as part of my training, I rotate around different medical specialties, and it just so happened that in August, after the peak of the pandemic, I moved into a sexual health clinic, and I was already doing some social media, and I decided to just do a TikTok about something that I was seeing in the clinic, and it was a really rubbish, I thought, TikTok, and I expected it to do like really badly, but it did quite well. So that's what really surprised me, and it showed me that even though some things might seem obvious to me, they're not to the wider population. And while I was working in the clinic more and more, I noticed that there's a lot of things, a lot of myths, a lot of taboos, a lot of misinformation that both men and women have about their sexual health or their private areas and things like that.
Yeah, definitely. It's so interesting that you said TikTok. TikTok is actually very, very useful tool for people. When I used to think of TikTok, I was just think like, oh, it's just people dancing and just young 12, 15-year-olds doing silly things. But now that I've gotten it during lockdown, it's actually so addictive. So now I just love it. I just learned so much from it. So I want to move into a topic of periods, because I feel like that's the most common question I'm sure that you get. So my one is very basic. Why are some periods so painful to some girls? Like they get period cramps, they get period pains, and then to some girls, they don't get any pains at all, such as myself. Whenever I get my period, I don't get any pains or cramps. Very rarely that I do, but it's not intense as some girls describe it as. So I want to hear your thoughts on that.
So period pain is really common, and it can be normal, and most women get it at some points in their life. So it's really good to hear that, you're quite in the lucky camp. It doesn't affect you that much. That's good. But what it's caused by is basically every month your womb's trying to get rid of its lining to kind of have like your house is a spring clean, your womb has a clean every month. So the muscle walls are like contracting, and when that happens, you might feel maybe something mild. Some people feel it quite more intensely. The other thing that happens is the blood supply to your womb kind of decreases when all of this is happening, and that's what kind of makes it feel like a bit of pain. But some women, there is an underlying health problem, and there is a problem sometimes in getting diagnosed as well, especially a condition called endometriosis, which is quite common. And I think it's getting more media now, but it's quite underdiagnosed. So if anybody is experiencing period pain, I would never tell them to just put up with it, or it's just normal, deal with it. Always try to seek help and find out why you're having period pain and what you can do to help. So even if there is no underlying medical condition, even getting into a good routine, so monitoring your periods, if you know when it's happening, preparing in advance, getting a good night's sleep, maybe doing a bit of exercise, because exercise can help with period cramps. There's a lot of things that people can do, sort of self-care things, to just help them get through that time. And some people, even if they're not having pain during their period, you're still getting the hormone fluctuation. So it is important to take care of yourself around that time.
It's just like whatever we do, there's always going to be some sort of effects to us every single month. But is there like a point where the pain is so intense? Like, how do you know that it's so bad, like so intense? What are some of the symptoms that's like severe pain from menstrual periods?
So there's heavy periods is sort of like even a different thing. So some people can have heavy periods. So that's when they're having to change their pads or their tampons very frequently, or they're getting leaks and things like that. Anytime you're concerned as a woman, that's absolutely fine to speak to a doctor. So because you know your body the best, so you know how your period normally feels. If it's feeling worse for you, it's absolutely fine to speak to someone about it. And the other thing is, even if your first period, and ever since you had your first period, it was really painful, and people might have brushed it off and said, oh yeah, periods are painful, that's not necessarily the case. And it's absolutely fine to go and speak to someone and say, look, this is affecting me quite badly. Let's just have a checkup and see what's going on. Because it's pain, it's quite difficult to explain to other people, or there's no real test for pain. So it really comes down to you just being in tune with your body and not being afraid to just go and ask questions.
So would you say like it's healthy for women to take paracetamol whenever they have their periods? Because I know there are some girls that I've met in the past, and every time they have a period, it's so like painful that they have to take a paracetamol every time. Is it healthy to take a paracetamol? Because like some of these medications, I'm sure they affect our menstrual cycles.
So it's absolutely fine to take things like painkillers if you've spoken to your doctor about it. So even the paracetamols are over-the-counter medication. There are some people who it's not suitable for if they've got liver problems and things like that. But if you're not in that category, and if you've not got an allergic reaction to paracetamol, it is quite a safe medication to use as long as you're not overdosing. Okay. So I think the normal dose for an adult is 2 tablets 4 times a day. So if you just keep to that, it's absolutely fine if you're doing that. But if you feel like the paracetamol is not helping, or you're now having to put in other painkillers and things like that, that's when you should also go and speak to a doctor, because we don't want you to just be using things over the counter and trying to cope. Just get some help, get some expert advice, and then just sort yourself out.
I love that. So what is a normal menstrual cycle length? Because I know there are some girls who have periods for like a week and they bleed a lot, and then maybe there are some girls that have their periods for like 2 days and they don't even bleed that much. Is there like an abnormal length? Is there a normal length, or is it just really depends on the girls?
Okay, yeah. So there's 2 things. There's one is the menstrual cycle. So that's the time in between your period. And then there's the length of the period itself. I think typically a period can be up to 7 days, but normally the first few days are where there's the most flow, and then it just decreases. So some people might just have spotting by the 7th day, or nothing at all. If it starts to become longer than 7 days, that might be normal if that's your pattern and you've had that since you started menstruating. But if that just develops later on, then it might be worth seeing a doctor to just say why you might be having periods for such a long period of time. There are some conditions that can cause that. In terms of the cycle, so you should be having a period on average every 28 days, but some women have it between 21 to 35 days. If you're having them at a different time, that's fine sometimes, but always just have a look and see if the month's length is the same every time, that's normally fine. But if it's varying by more than 20 days, then that might be considered irregular periods.
Oh, okay. So what does it mean when someone is sexually not active and they have irregular periods? Is that something to worry about, or is that just completely normal to our bodies?
So everybody can have irregular periods at some point, but it depends what you mean by irregular. So when people are undergoing a stressful time, or they've had a weight gain or a weight change, this can affect your period, how often you're having your period. But if you, as I said, if your period starts to vary so much that it started off being every month, and then now it's every 20 days, and then sometimes it's an even bigger gap, it's once every 2 months, that's when you need to talk to somebody about it. There are a few conditions which can cause irregular periods. The most common is probably polycystic ovarian syndrome, where I think we're going to come on to that later on, but that's probably one of the most common causes. But as I said, it can just be things like you're exercising too much, you're really stressed. I know for me personally, I never menstruate when it's my exams because I'm so stressed, I push it forward. Which is kind of good because I don't want to be on my period during an exam.
Oh gosh, really? I feel like my periods just surprise me whenever they want to. It's just whenever I'm stressed, that's for some reason that's when it comes, or maybe it comes at the wrong time, and it's just surprises me. I don't know why, but yeah, my periods are really irregular as well. I kind of somewhat have an idea of when it comes, but I don't have like a specific date, like how some girls chart it every month.
Yeah.
So it's literally just Mother Nature surprising me every single time. Yeah. Mine's pretty irregular. But yes, like you said, we are going to move on to the topic of PCOS. I think I can pronounce it, polycystic ovary syndrome, right?
Yeah.
Got it. Can you explain what PCOS is, and what are the symptoms, and what can girls do about it once they do find out they have it?
So there's three main features. One is irregular periods. The other one is excess amounts of male hormones in your body. So it says male hormones. Everybody has a bit of male hormone in their body, testosterone and other androgens, but it just means that level's increased a little bit more. And that can cause like facial hair, or mainly it's facial hair. There was other symptoms, but I think that's probably the main one, and sometimes acne as well. And the third feature is polycystic ovaries. So what that means is that there's little fluid-filled sacs in your ovaries, so like around the eggs, and that might be what's causing some of the hormonal imbalance as well. If you have at least two of those features, then you can get diagnosed with PCOS. There's a few other things that can come with PCOS, and that they're mainly, interestingly, like diabetes and insulin resistance. So it's because insulin's also a hormone, there can be an imbalance in that as well. So it's can be quite a multi-system disease.
Oh my gosh. That sounds a lot, but yeah, good to know that we know some of those symptoms for PCOS. So I want to move on to menstrual products in Boots and Superdrugs. What is your opinion on tampons and pads? Are they good for you? I've heard some stories from companies that they're actually not good for you, but I want to know from your perspective as a doctor, are tampons and pads good for you?
So it depends on woman to woman. So there are definitely risks associated with any sort of product, even if it's a medication or something like a tampon or a pad. The main things are infection. So not changing your pads regularly, and you get that buildup of blood, and then that can become moisture as well. That can become areas that can get infected. Other things are like friction, just from pads rubbing against your skin. And then tampons is a similar thing, but the biggest risk with a tampon is leaving it in and forgetting about it, and then that can cause a serious infection called toxic shock syndrome. So those are the risks, but there's normally nothing to be scared about. Most women are using pads and tampons every month. They're getting on fine with them, but if a particular person is having a problem with them in those kind of ways, then it might be time to look at different alternatives.
Yeah, absolutely. Yeah, it's just what's actually how many times should a person change their tampon or their pads throughout the day? Is it 2 times, 3 times, or again depends on your flow?
It definitely does depend on your flow, but probably, and I think there are some which pads on the packet, they say that, you can keep this one in overnight and things, and no one wants to be waking up every 6 hours of the night to just change it. So I think overnight that sort of thing is fine, but during the day, every 4 to 6 hours, depending on how heavy the flow is.
Yeah. So
Yeah.
what's your take on menstrual cups? Because I feel like that's a very new thing, and a lot of women are jumping on this, I wouldn't say trend, but jumping on this new way of taking care of their body and their period. But yeah, what's your take on menstrual cups? Because I use menstrual cups, and alternatively, as a backup, I use pads as well. But these are reusable pads that I wash and sanitize as much as possible. But yeah, what's your take on menstrual cups?
That's really good. I like what you're doing, because I think the main thing about menstrual cups is that we do have a crisis worldwide where people are finding pads really expensive because they're disposable and it's not good for the environment. Whereas a menstrual cup is a lot more economically acceptable. It's very safe to use. I think it's probably a little bit safer than a tampon overall. But as I said, every person, if you're happy with tampons and you're getting on with them fine, you don't have, I'm not saying you have to change to a menstrual cup, but if you're not getting on that fine, or you just want to try, some people just want to try something as well, something different, then yeah, it is a good thing to try. I think what some people struggle with at first is just getting it in the right position. So it's just practicing that.
It took me so long to get it up inside, and I don't really use pads way before I use menstrual cups. I just use like disposable pads, not tampons, and
Yeah.
I'm not used to like putting things up. Oh god, it's gonna
Yeah.
I'm not used to putting
Don't worry.
yeah, I'm not used to putting things up me. So it took me so long. It took me a year to actually get used to it. And but yeah, I think I made a really good choice with getting reusable pads as a backup. So then I don't have
Yeah.
to boots and super drugs and buy it every single time, because all of that money adds up, and we're throwing it out and I don't know where it goes once I throw it out. So I just feel so much better with this, and it's less irritating and less sweaty, and it's more hygienic as well, I heard. So it's just so much more comfortable to get throughout my day with it. So I want to move on to sexual pleasure and masturbation. I want to know, is it good for women to masturbate? What are some of their health benefits? Yeah, is it good for women? Like, what's your advice on sexual pleasure and masturbation for women?
So I think that this is more of a taboo. So unfortunately, so I think that men will talk about what they're doing and, you know, their masturbation with each other or whatever, and maybe show off even a little bit about it. Whereas with women, it's like, oh, do women even do that? People, yes, they do. The answer is, and it's very, very common. It's very normal. It's very healthy. Obviously every person is different, so I do like to just say that. So if someone's not interested in masturbating, I'm not going to say that they have to or anything like that, but in general, masturbation can be very healthy. So one of the main reasons why is that it releases lots of hormones, which can help you go to sleep, which can help you relieve stress. So yeah, and the other thing that I think it's really beneficial from it is you get to know your own body. You get to know what your arousal what your arousal triggers are. You get to know what gives you pleasure, and that just helps with a part. Even if you're never going to have a partner, that's fine, but if you do have a partner, then that can help you gain pleasure like with a partner as well. So if you know your body the best, then that's the best thing in general for everything.
Is there a point where you would say it's like a woman is masturbating too much? Is there such thing as too much masturbation or too little masturbation?
So it's the same with masturbation and sex. This is I've spoken to sex psychologists about this, and it comes down to the individual. So some person might be having sex or masturbating once a week, and they'll be saying, oh my gosh, that's too much for me, I can't handle it, why am I doing it so much? And other people will be like, once a week, that's not enough at all, oh no, why am I only having sex once a week? So it's really about you as a person and how it's affecting the rest of your life. So if you feel like it's taking over your entire life, you can't think about anything else, you can't function at work, that's the only time I would say that it's too much. So it's not about the actual number, it's about how it's affecting you. So it's very much psychological and depending on the person. But otherwise, you know, if someone's doing it 100 times a day, but they're happy, they're functioning, it really doesn't matter. It's not going to worry me as a doctor. The only thing I might think is sometimes people do get a bit of friction. So, you can use lubrication with yourself as well. If they're just, stroking themselves and then some friction burns and things like that. So you can just use lubrication with yourself or with a partner just to like limit that. And also, it is the safest form of sex to have sex with yourself, but at the same time, if you are using toys, you need to make sure that you're cleaning them properly. And sometimes it's even good to use condoms when you're using toys.
So, on the topic of sex, why do you think that sexual pleasure and masturbation is so taboo for women, but it's completely fine for guys and it's so normal for them? But for women, why do we put on ourselves like a shame of sexual pleasure and masturbation and getting to know our bodies and what arouses us?
Yeah, it's a really big question. I think it is culture and society, really, because I think there's this trend to kind of control women's sexuality. So some practices, ancient practices that you see or in different cultures can try to control a woman's sexuality in a different ways. So one thing that we see in sexual health is FGM, female genital mutilation, and sort of the thought behind that is to prevent a woman from experiencing pleasure, and then she won't, cheat on her husband and things like this. And I think that's where the toxic mindset comes from. Whereas if women have multiple partners, it's considered shameful and they're labeled with such horrible slurs. Whereas if a man does it, it's almost championed. And I think it's difficult to say where this comes from. I think there's different theories about this. So they have this thing called the Madonna and whore complex, that women are put into boxes, and a good pure woman is like this Madonna. She's a virgin, she doesn't want sex, or it's just so archaic. And that's more of a motherly type of person. And then the other side is someone who does enjoy sexual pleasure, and that's labeled a very disgusting term. But that's the kind of thing that women have to contend with. And I think that's why it's internalized as well. But it is really disgusting we have to be frank about it. It's absolutely disgusting. The fact that it's been perpetuated, I think, over time, over centuries, trying to control women, being scared that, I think it comes down to being scared about paternity, like, oh, I need to make sure that the baby is mine. So I need to make sure that my wife is, very much pure and would never look at a man and things like that. Whereas all of these things are just so natural. And if men are allowed to be a certain way, there's no reason why a woman isn't. And these days we have paternity tests, so nobody needs to worry about things like that.
Really. It's just I think, like you said, there's just so many factors environmentally around us that affects us to think that, like, oh, we shouldn't be exploring our own bodies. Like, I feel like in some religions as well, like, it's frowned upon for a woman to masturbate. I'm not sure if they say the same thing about guys as well, but I know for women, they just like, no, this is a big no, don't do that. And I think, for my personal opinion as well, I don't think there's anything wrong with a girl exploring her body as well. I think it's very empowering, and I think that's just her getting to know her, and it is a form of self-care and self-love. So I think there's nothing wrong with it, so go ahead.
Yeah, absolutely. What you said, body image is a big problem in today's world as well. And I think some surveys have shown that people who do self-pleasure have better body image. So that's amazing. And self-care, absolutely. It's a nice way to self-care for yourself.
Yeah, absolutely. So on the topic for young people listening on this podcast. So for people who are, doing sex for the first time, like, why does it hurt the first time that they do it? Is it maybe because they don't know their own bodies yet, so it's kind of painful for them when they do it the first time? Is there a way that they can make it more comfortable for themselves doing it the first time? But yeah, maybe because they're not used to putting things up there, so they're like, anything that goes in there is just so painful. But yeah, why is it so painful for young girls or even young guys, just so painful to have sex the first time?
Yeah, I think so. In sexual health, if someone's having pain during sex in general, we do not consider that normal at all. So we always want to see them in clinic and examine them. I think it's a little bit of a myth that the first time should hurt. It comes along with the hymen myth that, women have a hymen that gets broken during sex. And I think that's what's supposed to be painful. But the truth is that everybody is born with a broken hymen, as in everyone's hymen, which is just a covering on the outside of the vagina. So the entrance of the vagina, there's this little flap of skin. Everybody has holes in it. There are some women who are born with an imperforate hymen, which means there's no holes in that hymen, and they don't experience periods because there's a barrier to their period coming out every month. And they actually need an operation to have that removed. So I've actually seen somebody in clinic when they had sex for the first time and they couldn't really have sex because their hymen was imperforate and they had to have an operation to have it removed. So this idea that just having sex can, remove your hymen is definitely not true. What might happen during sex is that the hymen might stretch. So that covering might stretch as something's coming inside. And for some people, if there's not enough lubrication, I think typically that might cause a little bit of bleeding. But most women really shouldn't bleed either during their first episode of intercourse, because if there's well lubricated, then you wouldn't really experience that. And even women who've had sex still have a hymen. So the hymen myth is just so out there that even like doctors will be writing about it like intact hymen. I'm thinking, what does that mean? Because nobody has an intact hymen. And even medical students will come and say to me like, oh wow, I never knew like this, that the hymen just stretches, because it's really like talked about as breaking. It definitely doesn't break, and it's still there after you've had sex. So there's no such thing as a virgin test. Like, this is just all almost made up.
Oh my gosh. Like, just when you told me about the surgery when you had a patient that couldn't get a period because her I don't know what was the barrier was just not letting anything.
Yeah, the hymen, yeah.
Hymen, yeah. Oh my God, I didn't know you actually had to go into surgery if it's, that bad. I've never been taught this at school, so I'm so happy that you've mentioned that. But thank you for clearing up the hymen myth, because when I was younger, I actually thought that's how you could tell if you've lost your virginity or not, when you bleed the first time. But now it's just, oh my gosh, maybe it was just my period coming. I don't know.
Yeah, well, it can be a different, as you said, you sort of said it yourself, when it's somebody's first time, there is probably a lot of psychological things going on. Sex gets better with time, with getting to know your body, with experience, knowing what feels good for you. So that's why, I think it's definitely probably more of a friction thing or inadequate lubrication and things like that causes bleeding the first time. But even in the first time, I'd be happy to see somebody if they were having pain or bleeding, just to give them some reassurance. And if that continued to happen, that's not normal. It's not normal to have pain during sex. So definitely speak to somebody about it, especially if it continues.
Yeah. What would your advice be to young people who are having sex for the first time, but they're a little bit nervous and they want to make this as enjoyable as possible? So I know you've said like lubricants and getting to know your body, but is there any other tips that they can, ease their nerves a little bit more?
Yeah, I think that there's a lot of pressure on young people to perform in the bedroom, or a lot of things that they've seen is through pornography, which is very much almost like when you're watching a Hollywood film about a romance, it's very much dramatized and it's just for entertainment purposes. But people feel that pressure to like perform like a movie star, or like whatever they've seen in pornography in their real life. So I would encourage people to sort of put that to one side, realize that very much is just like a TV program, or it doesn't represent real life. And the best thing you can do is the person you're having sex with, to communicate with them. So I think if you're going to have such an intimate experience with someone, it's really good if you can also have an intimate conversation with them as well, and just talk about what your concerns are. A lot of when people might feel conscious or shy about their body, talk about it. I'm sure that person would be reassuring them. And the other thing that you can do is make sure that it's an environment that where you have control. So, you know, consent is very important. So talk about what you're happy doing, what you're not happy doing. And I think a lot of young people feel very insecure that if they disclose their feelings that they might get rejected. But if somebody rejects you for that sort of thing, then you probably deserve somebody better. So it's also about having that kind of self-confidence to say that there is always someone else out there. If someone disrespects you, if someone doesn't respect your boundaries, or someone's pressurizing you into doing something you're not comfortable with, always try to have the confidence to at least speak with someone, like a close friend, and hopefully at least they can encourage you to just look elsewhere. So making sure that it's with the person that you're comfortable with. It doesn't have to be someone you're in love with. It doesn't have to be someone that you're in a long-term relationship with, but at least you have to be very, very comfortable. I think that's what's going to give you the best experience.
Oh, that's amazing. A great advice. I hope the listeners are actually listening to that, because that was gold advice right there. So we want to move on to the topic of STDs and STIs. Can you please explain what is the difference? I thought they were the same thing, but now I'm hearing they're actually two different things. So can you clear up what is STDs and what is STI?
Yeah, I actually only looked this up recently myself, because I think I just use the word STI probably more commonly. And I think STD is like the old version of what they used to call it. And they realized there used to be some other really like horrible, weird term. They used to call it venereal disease and all this kind of thing. And they found that that's quite stigmatizing. So when you tell someone you've got a sexually transmitted disease, they can find that more stigmatizing or more shameful or more upsetting than if you say sexually transmitted infection. And that's really interesting, because I think language does play a big part in how people react. And the thing with sexually transmitted infections is that the majority of them are treatable, or they don't have a major life-threatening impact. But people find them psychologically very difficult to deal with, because you have to often talk to your partner about it, or possibly even future partners about it. And that's what really gets them stressed out and anxious. So anything we can do to try to like normalize it or reduce stigma is a good thing. But I think the main difference is that STD stands for sexually transmitted disease, STI is sexually transmitted infection. I think it's very minor. I think the main nuance is that an infection is not necessarily a disease. So a disease might be something more long-term, whereas an infection is something a little bit more short-term that can just be treated and go away. Whereas if it stays longer, then it could develop into a disease.
Oh, right. Okay. But it makes a lot more sense the way that you've explained it. So is thrush an STI?
No. So thrush is forget the S and the T, just the I. Thrush is just an infection. So it can happen to people who are sexually active, I think a little bit more commonly, but it can happen to people who are not sexually active as well. And basically, the vagina has what's called a microbiome. So this is good bacteria that sort of protect it. They produce different chemicals, and they want to keep your vagina a little bit acid. That's the environment your vagina likes to be in. But when those good bacteria get lost or die out or overtaken, that's when you can develop something called thrush, which is a yeast. So it's like a fungus. And it it sounds a bit scary, but we have fungi all over our body as well. They can also be good fungi. Like, for example, for example, the good bugs that you get in like yogurty drinks and stuff, some of them can be fungi as well, sometimes probiotics. So it's nothing to be too scared about. It just means there's been an imbalance. Now this yeast is growing more inside the vagina. Now, what might cause that imbalance? It could be washing. So actually that's a really common cause. So nobody should ever wash inside the vagina. There's two parts to your female area. One is the outer part, which actually is called the vulva. So the vulva is the skin on your pubic mound, your inner and outer lips, those are the vulva. And then the vagina is just the inner tube. No one should be washing inside of their vagina, because if they do, they're just washing away all the protection. And then that means that the fungus can start to grow. So ironically, thrush is something that can happen in people who are too clean, because they're just scrubbing away, washing inside. They're getting rid of all that protection, and then thrush gets really happy, comes out and starts causing them some symptoms. So you probably know some of the common symptoms of thrush. It's very common. It's a very common infection, actually. So it's like, yeah.
I think I do. I don't know.
No worries. So I can go through it. It's like it's going to be a bit funny now, because the way medicine describes some things can put you off certain foods afterwards. So they describe it as like a cottage cheese discharge. So like a lumpy white discharge. That's probably the main symptom of thrush. So if people are that's the main discharge symptom. I forgot about the most more important symptom, itchiness. It can cause a lot of itchiness for people. But there are lots of treatments out there, very simple ones. One is Canesten pessary. So you just insert that. I think you can probably get it over the counter as well. You just insert that into the vagina, and it just kills the yeast and lets your normal vaginal flora grow back again.
Does it cause you to go to the toilet more often?
It could do, possibly, yeah. And people might find that when they're peeing, that it hurts when they're peeing as well. But normally, going to the toilet more often might be a bladder infection, so urine infection more commonly. But if it's like irritating the opening of your urethra where you pee out of, then it could cause a UTI even. So it's good to just get these sort of things sorted out. That's another thing. A lot of people don't know that the urethra is separate to the vagina. So a lot of people think that they pee out of their vagina, whereas the urethra is a separate tube. Even when I was a medical student, I have to admit that I wasn't fully clear.
That's me as well. I'm on the same boat. I genuinely thought that we pee from our vagina. But then when I Googled it, or I think it was someone on TikTok that was saying we actually have 3 holes. One is our vagina, one is our urethra, and the other one is where we go to poop. And I was just like, I was so surprised, because I thought I knew everything about my own body, but apparently not. I actually have 3 instead of 2. So I was just so shocked. And then I was so kind of very disappointed in my school that I didn't know about this, because I was expected to know everything. I was expected to be taught everything, but I didn't know that we actually have 3 holes and not 2. So I think that even the educational system even fails to teach me and maybe some future generations just basic sexual health things. So I was pretty shocked, also disappointed at the same time.
Yeah, it's absolutely true. I think no one's ever really told me that they've had good sexual education at school. No one I've come across. So I think it's a problem everywhere. And it's definitely more about women's bodies. I think I didn't even get properly taught what the clitoris was at school either. So, there's so many gaps in knowledge. There's a lot because especially a man's organs are very much external as well. I think that maybe, and people are always drawing diagrams everywhere of the penis, and whereas the vagina and the vulva just get like hidden and forgotten about.
Yeah, I think that's a really good point. It's just that we're more the internal and the guys more like the external stuff. So it's just so much easier to learn about the boys' bodies than the girls. That's probably why. But I want to ask another question about STDs. I know this probably might be a broad one, because I'm sure there's so many different types of STDs or STIs, if I'm not wrong. But what are the basic general symptoms of STD that girls can be aware of?
Really good question. And actually the answer is that a lot of STIs can be don't have any symptoms. And that's kind of a problem, because you might be having You might have had one partner, finished a relationship, not know that you have an STI, have a relationship with someone else, be passing it on and not know. That's why we encourage anybody who's sexually active to just have an STI screen every few months, not typically every 3 months, because a lot of them don't have any symptoms at all. What symptoms can you have? So in women, it would be abnormal discharge. That's the most common one. But a lot of people might not know what that means. So really, it would be maybe a change in the color of your discharge. And other symptoms can be pain during sex, bleeding after sex, or just irregular bleeding. All of these can be a sign of an STI, but it could also be a sign of other things as well. So it's not very specific. In general, if you're sexually active and you're having different partners, then have an STI test every 3 months. If you're in a long-term relationship, you should still have a STI test once a year.
Yeah. So what do the different colors of discharge mean? Because there's white, there's clear, like what are the colors?
So what do they mean? Good question. So some of them can just be different parts of your cycle. So when you're ovulating, so that's in the middle of your cycle when you release an egg, your discharge, they say, and the textbook looks like an egg white. So that's that clear kind of discharge. At other times, it's normally clear, or it can be maybe a little bit white. But if it's very white, thick and clumpy, that's when we think thrush. So that's white, thick, clumpy thrush. Clear or very light amount of white or something, that could just be normal. And you have to remember that sometimes it reacts to your underwear. So after a while in your underwear, it can change color. So sometimes discharge bleaches underwear. So the color of, because it's acidic, so if people have like colored underwear, it might bleach it, or it might turn yellow over time. That's not what we're talking about with discharge. What we mean is the actual color of it when it comes out. So it's important to distinguish like the color of your underwear from your discharge. Other colors, green and frothy, I think it's very rare for this to actually happen, but that's a sign of a STI called trichomonas, green frothy discharge. What other types? Those are probably the main types of differences in color. A thin grey discharge can also be a condition called bacterial vaginosis. It's very similar to thrush, but instead of a yeast infection growing, you get a bad bacteria growing inside your vagina. Again, it's not related to sex. It's just an imbalance in the good and bad bacteria.
Okay, is that maybe one of the reasons why that our vagina smells? Because I feel like in general our vagina smells anyways, it's completely normal, is that fishy smell. But yeah, so like why does our vagina smell, I guess? That's a big question.
So as I said, there's good bacteria living inside your vagina, so they're producing lots of different like good chemicals that keep you safe. In fact, those chemicals can like prevent an STI from happening. They prevent infections. They keep it healthy. They can even prevent, they're looking into seeing whether they can prevent even cancers and stuff like that happening in that area. So they're really good for you. But because of the sort of substances they're producing, and it's moist as well, so that can just produce like a musty smell. It shouldn't be too fishy. A fishy smell is normally associated with a bacterial vaginosis infection. But I think the other thing is it's important not to get too self-conscious about the smell as well. Because I think what happens is some women start getting self-conscious about the smell. They start using different products. They start washing. And then that smell gets worse because you got rid of the good bacteria. The bad bacteria have started growing and you've just made things a whole lot worse.
Oh gosh. What is this? What do you think of the myth of people saying if you eat pineapple, your vagina, just smells amazing? I mean, to me, it sounds, when I was younger, it sounded like, a great natural way, just by eating it, not putting it up there, just like eating it.
Yeah.
And like, I used to fall for it when I was younger, but now that I'm a little bit older, it does sound a little bit insane. I mean, just because I eat pineapple doesn't mean that my vagina is going to suddenly taste like pina colada. What is your can you bust this myth and explain why this is not true?
Yeah, it's really interesting, and I've tried to look it up as well. The only possible so if you think about it, you eat a pineapple, it gets digested in your gut, and then it gets as well in like, you know, sugars or vitamins. So I was really like thinking, how would it change your secretions in your vaginal area? That doesn't make sense. The only thing I can think of is certain foods. If you eat a lot of meat, if you go onto the keto diet, there's such a thing like called the keto sweats. So there are obviously vagina, but there are around the vulva. So in your groin, there's some sweat glands. So I don't know if like eating a lot of pineapple could make your sweat change. That's the only thing. But otherwise, I don't think it really helps. There's something called like a placebo effect. So sometimes, you know, if we really believe, but other than the placebo effect, I can't really see how it would work. If you are concerned, or, you know, you want to, no one should, first of all, no one should be concerned about how their vagina smells or tastes as long as they're keeping it healthy. So what are the things that you can do to keep it healthy? Wearing breathable underwear, changing it regularly, just washing with warm water. So on the mound, warm water and soap is okay. On the lips, just warm water, and then nothing on the inside, right? Just sticking to that is perfect. That minimizes the risk of yeast infections, minimizes the risk of bacterial vaginosis. Using condoms, if you're sexually active, will also help prevent imbalances and obviously infections. Those are the main things that you can do to keep it healthy. If you keep it healthy like that, it's going to smell and, you know, taste absolutely fine. So you shouldn't be concerned about it.
Good to know. Good to know. So with that myth, what do you think of some of the Femi Fresh products are in Boots and Superdrugs that are marketed to wash your vagina? Like, are they safe to use? Are they even worth it? What do you think?
They're definitely not worth it. So a lot of women who come in and I say to them, are you washing? They're like, no, all I'm doing is using Femme Fresh. I'm like, no, stop. And it's really difficult for women because they think they're doing the right thing because they're not just using regular soap. They're buying a product that is just for the female, you know, body. But there's no need. As I said, your biology, your body's already strong enough to cope with whatever's thrown at it. You know, for centuries, before Femme Fresh ever existed, women all over the world through centuries were able to, you know, get through life without that kind of thing. I think that kind of thing is really there to prey upon women's insecurities. So it's like, oh no, I need something to wash there, or I need something specially for women to make me feel better. You never find you don't find men fresh. And to be honest, the male body, the penis and the testicles do not self-clean, unlike the vagina. So you probably need more men fresh rather than femme fresh.
Oh wow, I love that answer. But that's really good to clear up because I'll be honest, I have bought one before, but I never use it to clean the inside. I only use it to clean the outside. And luckily I have not had any issues with it. But ever since then, I've not bought it because I just don't really see the point in it. So, and now that you've just confirmed to me that it's not worth it, it's not even safe to use, and it's just preying on girls' insecurities about their bodies. So I don't know why they're still in Boots and in Superdrugs, if I'm honest. But yeah, hopefully listeners will actually learn from this and just know not to buy it. Okay, so I've been asked by the NHS to go to my cervical screening done, but the thing is, I'm really scared to go in because I've seen videos of it and it looks really intimidating. What are some of your advice to give to me that I can feel less nervous going in?
Yeah, so it depends. Sometimes people have already had a speculum exam done before. Have you ever had a speculum exam done before? Do you know what that is? No. I have a speculum in my room. Should I tell you?
Oh my gosh, get it out.
Speculum is, right?
Oh my gosh.
So what happens in a smear test is they put this inside the vagina and they just open it slowly and they take a little brush and they just brush the cells of your cervix. and I just take it out. But you are used to putting a menstrual cup inside, so at least that's, it's not going to be completely foreign to you. They use lubrication on that speculum, just slides in, and you lay back, you relax. If you want to, you can listen to some music and just let them get on with it. It probably only lasts a few minutes, and that's it, you're done. Any kind of tips to make you I think the thing that you've got to remember is the person who's doing it has probably done it thousands of times. So a lot of women come in to me and say, oh, look, I'm sorry I haven't shaved. I'm just thinking, don't worry, I'm not even going to notice that, because we're just too busy trying to do our job. We don't even notice if someone's legs aren't shaved, if someone hasn't shaved, their pubic hair. And also, I don't care. Like, it's absolutely fine. It's quite healthy to have just trim. Like, if you want to, you can trim your pubic hair or you can keep it. There's really no health benefit either way. So that's one thing that people are self-conscious about. I think the other thing is maybe just the appearance of their private area. But honestly, we see women of all different ages, all different nationalities. We probably forget about, as soon as you leave the room, we're not going to really remember anything about that. We're just going to be busy, like, trying to get our brush in the right position and get it done. So I think some people are worried about pain. Is that something that concerns you about it as well? So it shouldn't be painful, because it's just this. Sometimes if they struggle to find your cervix, that can be a little bit uncomfortable. It's not necessarily going to be the most comfortable thing you've ever done, but it shouldn't be painful. And it will be quick, easy, and over and done with once it's done. And you can feel really happy afterwards because you've done an amazing, like, self-care for yourself, because getting checked out for what the cervical smear test does is check you for a virus called HPV. Mm-hmm. And HPV is actually the most common sexually transmitted infection, because it's just from it can even happen from just intimate skin to skin contact. So even if someone's not had sex, or even if someone's used a condom, you can still pass on HPV to each other. And HPV, some forms of it can lead to cancer. So just getting checked out can prevent you from getting cancer. So, that's amazing, isn't it?
Yeah, absolutely. It's just by, like, a little swab inside the cervix, they're able to just know and do a test. So is there something to worry about if when I do get the results, and let's say it comes, like, negative, or there's, like, signs of bad cells in there? Is that something that I need to be worried about? What can I do about it?
You don't necessarily need to worry about it. So if it comes back and says that you're HPV positive, what they normally do is just give you another smear test more quickly. So normally it's every 3 years until the age of, I think, 60. Young women, it's every 3 years. Eventually, I think when you get into your 50s, it's every 5 years that you have a smear test. But if you're HPV positive, so it means that you do have the virus, then you'll have a smear test more often. It's nothing to worry about, because, as I said, it is the most common sexually transmitted infection. So a lot of people have it, and cervical cancer is not that common at all, compared to how many people have HPV. If you've got abnormal cells, again, that doesn't mean that you have cancer. It just means that they're a bit abnormal. They're just a bit interesting, might not as well. Okay. So in very young women, we don't even do a smear test under the age of 25, because even if they have abnormal cells, they'll probably go back to normal by themselves. And so we don't bother worrying them about it.
So what can I expect to happen from the cervical screening? Obviously, besides, the swabbing inside, but just like from pre-cervical screening to aftercare, what can I expect from before and after?
So beforehand, you normally get a letter in the post inviting you to your first smear test. You go in, as I said, you have the procedure. It probably lasts about 15 to 20 minutes, and you leave. What happens afterwards is you'll either get a call from your GP or a letter. And if the letter says it was negative, don't have to worry at all. In 3 years' time, you just go back again. If the letter says you need further tests, I wouldn't worry. I would actually feel happy that you went to have your smear test, because it found something, and now something can be done about it, and something that could have been dangerous can be prevented.
Yeah. So is there a lot of girls that actually skip this? I'm not too sure, but as a doctor, have you ever heard from your female patients say, "Oh, I'm not going to go to my cervical screening"? Yeah, have you heard of that?
Yeah, it's actually, I think, can be a lot of people do skip their smear test. I can understand for different reasons. I think part of it can be nervousness, not wanting to do it because it's embarrassing. It could also just be a busy lifestyle. I think getting in contact with a GP can be a nightmare sometimes. All those factors playing a part. But yeah, as doctors, we always want to encourage people to get it done. It does save lives, and it is one way that we have, one of the best ways we have of preventing cancer. And anything that I can do to prevent cancer, I would want to push further and further.
Oh, yeah, that makes sense. But absolutely, that's a really good advice to encourage people to go in and get their cervical screening. So I want to know from your experience, what are some of the most bizarre things that your patients have come to you about their vagina problems?
So I think a lot of people are scared that if they do something that maybe is out of the norm, that they don't want to talk about it to their doctor. But actually what I find more bizarre is not somebody getting an STI from their sex toy, or someone putting something abnormal into their vagina. What we normally have then is like a woman to woman conversation, like, why are you doing that? We just both laugh about it. But what I find really bizarre is when people come into me and they say, oh, I'm thinking of having an operation to have a vaginoplasty because I think my vagina doesn't look very nice, or a labiaplasty. And I'm just sitting there feeling so sad that woman's feeling so insecure about her body for literally no reason. There's sometimes they literally ask me, like, does that look normal to you? And I just have to say, look, I know I'm a doctor, but I'm going to just say, look, you are beautiful. Every part of you is beautiful. Please don't worry about it. And honestly, the people who say this to me normally have like perfect symmetry. Some people worry about asymmetry. Asymmetry is completely normal, but sometimes people don't even have anything that I can see that would concern them, but they're feeling concerned. That's what I find the most bizarre, the fact that so many women are so concerned about their body for no medical reason at all. Just insecurity, probably like because of false body image that's perpetuated.
Okay, so for my last question, what do you want the viewers, well, the listeners, to know about their vaginas? Any last messages for the people listening on the podcast?
So yeah, I think what I want people to know about their vaginas is that anything that they're concerned about, don't keep it to yourself, because that's when you start becoming self-conscious and maybe more anxious. Always talk to someone if you're not feeling confident, if you're concerned about anything, and try to feel confident in yourself, because the vagina is an amazing organ. It does so many different things. It's a pleasure area. It keeps your uterus safe and healthy, and it has potential to even help you have a baby one day if that's something that you want. So it's got so many different features to it. Just treat it with love and feel happy within yourself about it.
Oh, that's a beautiful message. I absolutely love it. So we're going to wrap it up there. Thank you so much, Masarat, for being on this podcast. I really enjoyed learning all of this from you. I hope you enjoyed as well on this podcast.
I want to thank you for, first of all, bringing such an important topic to your audience. And it is difficult for anyone, even for me sometimes, to talk about these topics. I want to thank you for being confident enough to talk about this kind of thing, because I think it'll be so good for your audience to learn more about. And thanks for the opportunity for me to
so where can people find you on social media?
So my handle is Self-Care Doctor. That's the same on Instagram and TikTok as well.
Great, cool. I will leave Masarat's social media handles in the description box somewhere, guys, or somewhere in the link that you can find. But yeah, please go check her out. Her content is amazing. You will learn a bunch. I absolutely love them. And thank you all to everyone at home listening. I hope this has been really helpful. If there's any questions, please send them over to me, and then I'll send them over to Masarat. And hopefully we'll get your questions answered. But yeah, I hope you guys enjoyed this podcast. Thank you so much for listening, and I will see you in my next one. Bye. Mwah.